So we use it really as long as the patient needs it, and then we wean them off or titrate them down from the medication to a point, in our example, where they're no longer diabetic and they no longer require the medication.
Welcome to the Orange Tea, where we explore thought leadership on performance and wellness to insights on modern healthcare. This episode features Jeff Bernhard, president of Heuro Health, and Dr. Tom Walsh, clinical director at Heuro Health. Together with the host Stephen M. Perry, they are tackling one of the most urgent and costly healthcare challenges in America: obesity, type 2 diabetes, and the expanding demand for GLP-1 medications.
So we're starting to talk about GLP-1s. Is Heuro just tied to GLP-1? Are you guys just a GLP-1 company? What can you explain how you're positioned to interact with that groundbreaking drug?
Yes, GLP-1 agonists are fantastic medications. They're really a big change in our armamentarium for treating diabetes and obesity. But there are other options. And actually, in most of my clinical experience in my past practice, we use other medications other than GLP-1s. They can be very effective. Again, the take-home message is you have to have a wraparound journey. You have to look into the dietitian education, the changing the mindset, exercise, getting people moving, et cetera. And either kind of medication can be used. We don't have to use a GLP-1 agonist all the time.
Yeah, from my perspective, we have clients coming on board that will be using less expensive generic medications as a first recourse. And if that doesn't work, they'll step them up to the GLP-1 medications. One point I want to make, and I want folks listening to this or watching this to understand, is that our goal is to use these medications as a bridge, not as a lifetime of use. We use it to serve a purpose, to get you from one side of the river to the other, and eventually come off it. I don't need to tell anybody here compliance and adherence to medications is very difficult, especially when you're injecting yourself. So we use it really as long as the patient needs it, and then we wean them off or titrate them down from the medication to a point, in our example, where they're no longer diabetic and they no longer require the medication.
And do you think your program can identify where a physician has prescribed maybe too small of a dose of a GLP-1? Yes. And they're just titrating the diabetes, but they're not really treating the obesity. Does your software have the ability to flag that in the system and alert your specialists?
It's done it.
Yes, it does. So when we get a data dump, we get 15 to 18 months. And what we actually see is, to your point, so if you take Ozempic as an example, that goes up to 2 milligrams. We see people on 0.5 for 12 months. That's treating the diabetes, not treating the obesity.
Yeah, I think the science behind GLP-1s is it's like a neurotransmitter. So it kind of connects the stomach to the pancreas to the brain, and it actually can quiet the brain down a little bit so that you may be able to learn some new things. Is that your view of it, Doctor?
Well, that's a really great point. I mean, it's tough to focus on something when there's a noise going on. And the food noise is real. I used to kid patients all the time that as we start you on these medications, you're going to stop thinking about, is the casserole from last night still in the fridge, or is there still some of that pizza in the fridge? You're not going to be thinking about that. Or if you do, it'll be a fleeting thought that'll leave your mind. And they really do work well for that. That's our opportunity. That's the golden period we need to take advantage of and re-educate people. Now we're talking about better food choices. Now we're talking about changing our day-to-day habits and making those habits more automatic. And while the food noise is quieted down, that's the golden period to take advantage of.
Yeah, I think muscle loss on GLP-1 is an issue. What are some of the things in the Heuro journey to mitigate the impact of muscle loss and try to minimize that as much as possible?
That's a real favorite topic of mine. And our average patient in our practice, and we had groups, we'd measure this off and on again, didn't lose any muscle mass at all, and some even gained muscle mass. Well, why? One, slow, proactive, thoughtful titration of the dose. A lot of people want to be on the maximum dose if they can. Just start it, and I want to lose the most weight I can before the summer, before the holidays, or whatever your target date is. That's exactly the wrong way to do it, because you run into more side effects, in particular muscle mass, nausea, constipation, all the things that can go along with GLP-1 medications. The other is movement. Exercise is really key. A lot of folks that are overweight for a long period of time come in and their joints ache and their back hurts, and they're really limited in what they can do. We developed a partnership with a company and have it integrated into our app that can start out with individualized programs for getting people moving and building muscle mass.
Yeah, and would that include some resistance training?
I love resistance training. Absolutely. It's great to go for a walk, and everybody should do that. It's great mentally, clear the mind, listen to the birds, all that kind of stuff. But we need to build some muscle mass, yes.
And you've mentioned dietitian expertise, and you're married to a dietitian. How does the diet play into muscle loss prevention in the Heuro journey?
It's a great question. So I think the average person doesn't eat enough protein, okay?
Not even close.
And so that dietitian is working closely with the obesity doctor and the coach, but mainly the obesity doctor to monitor what they're eating to ensure that they are getting an adequate amount of protein in relation to the other things. You want to add to that?
Well, and know where to find it. It's really,
Right.
A lot of folks don't know where protein is in all these foods. So we teach people to read labels, but also some of it is not affordable, or there are more affordable forms of protein and mobile forms of protein. You can't carry a T-bone steak to work with you, but you can bring protein shakes and protein bars,
yogurt.
or yogurt. I mean, healthier mobile choices.
Thanks again to Jeff Bernhard and Dr. Tom Walsh for joining us. The challenges surrounding obesity, type 2 diabetes, and the increase in GLP-1 costs aren't going away, but today's conversation shows that sustainable, scalable solutions rooted in whole person care do exist. Whether you're an employer, provider, or patient looking for a better way forward, Heuro Health's model is one to watch and one to learn from. If you enjoyed this episode, don't forget to check the show notes for more resources, including our full interview with Heuro Health founder and CEO, Jesse Kessler. Subscribe for more conversations like this, where we explore how to build high-performing teams, drive lasting impact, and think holistically like a T-shaped professional. Until next time, thanks for listening to The Orange Tea.